I get asked a lot about what's the role of social media in hematology oncology, not only for our patients and caregivers, but on our side, the investigators and physicians. I think it's actually such an important area that it's no longer an emerging area or a hobby or something optional. I actually really think all of us need to have some working knowledge or awareness of social media. For me, it allows me to get direct information about rare cancers that I treat straight from opinion leaders, straight to the general public, patients, caregivers. It allows me to disseminate new articles either by my own group or by other groups, and it allows me to interact with other thought leaders to get their opinion, especially at conferences such as this at the EHA meeting. I think organizations such as yours, VJ Hem/Onc, are very, very important for a few reasons. One is they facilitate a third entity outside of patients, outside of investigators, that amplifies the message at these meetings for either key trials, as you guys have nicely highlighted, or novel studies in new directions. Another aspect of VJ Hem/Onc getting involved in social media is it gets brand recognition for academic investigators, specifically for our junior investigators, young investigators in the field. Interviews such as this are a great way to get your own name out there, your own message, and I think it's actually, quite frankly, a great way to get other people to know about your own work. And finally, I think that people get information in different ways. Yes, this is the information age, but not everybody gets their information from a simple Google search or asking their local physician. And while social media has pitfalls, you should never and cannot get direct medical advice or specific advice for a specific situation. You can get general advice, things that can get you thinking, or very importantly for me, with the rare cancers that I treat, I want patients to know they're not alone. For example, if you have BPDCN, if you look it up in general literature, this is a very rare disease. But I want you to be able to find me and other people who've dedicated their life, who are interested in that disease, who have clinical trials, directly, quickly, and be able to have some ability to interact with those folks. So I believe that this is an imperative of the modern era of medicine, not only managing data as you do with electronic medical records and the internet, but also having a working awareness and knowledge. And I think organizations such as VJ Hem/Onc help to facilitate that discussion.